Thank you. Hello everyone, I'm Julie from Leeds. I'm just going to take you through how we developed a city blueprint and where we're up to with that. So we first worked across health and social care in around 2012, and we put together, this slide shows the governance that we've got in place across health and social care around linking into informatics. So as you can see, it all links back to our Health and Wellbeing Board at the very top there, linking into our Health and Social Care Transformation Board. And beneath that, there's this Leeds Informatics Board. So we're working across health and social care with all the key players. So it's chaired by one of the Leeds CCGs in Leeds, of which there are 3, and the other 2 are represented. It's got chief executives of each of the different organisations in health, such as the Leeds New York Partnership Foundation Trust. It's got local authority chief technology, chief information officer, and it's also now got the universities involved. So we've got all the key players working together to drive the agenda for informatics across the city. We've actually also got a citywide leadership office, so we're working together in terms of a delivery plan with a programme manager, and then we have local resources that work across the 2. So when we first came together, we looked at, so what are we doing across the city? And at that point, we didn't have any joined up plan at all. So the first thing we did was to say, let's try and get on one page everything that we're doing in health and social care. So as you can see here, this was our plan on a page. And the very bottom, each of the bottom boxes shows there's a box of things we're each doing individually. And we were doing some things, we were all doing some things individually, but the same. So such as the NHS number, wireless technology, interoperability standards, mobile working. We were all working on similar things. But we recognised that between organisations, we had a set of things that we needed to do together. And they're shown in that middle black band there. And in the centre of that is the Leeds Care Record. So we had a workshop with our professional practitioners and clinicians and sat down and worked out what is it that would actually make a difference. And pulling together information in a single view record across health and social care was really where we needed to be. So the central core section there sets out that Leeds Care Record, that interoperability of system information coming together. And all the things that are wrapped around that are all around us, we're all around us, the vision we had of delivering that. And then at the top there, there's monitoring and commissioning systems, so data and intelligence that we recognise is needed for the system to operate, to actually look at the secondary use of information. So what we then did is we started working together, and the things that are now in a cream colour are the things that we've actually achieved by working together as a unit across health and social care, rather than working independently. So we have a programme and we've delivered some of those things, such as the NHS number on the social care record. And we've actually moved quite significantly on with the Leeds Care Record, which is open source. It's something that we're hoping as a pioneer we'll be able to share our experience and knowledge on, so that other people can look at how to adopt a similar principle in other places. This is a diagram. If you go into Leeds Care Record on the internet, you'll find our web page, and this is our infographic which shows the highlight report from each month of where we're up to. We've now got 1,000 people using the system. We've got most GP surgeries information on the system, and we've got acute information. We've identified social work role-based access, so we're looking at what actual data items a social worker should be able to see of primary and acute data, and we've identified that data set. If we're successful with the Integrated Digital Care Fund, which we've still got our fingers crossed, we will be moving on to put that role-based access in place so that we can look at social workers actually accessing that data directly. We're also then looking at social care data being uploaded into the system so that health colleagues can actually see the data that we hold, and we've yet to work out which data items that would be. And mental health and community data, we're in the same position with. The aspiration is to put that data in the system as well. So that allowed us to actually start to pull together for transformation. And here's a quick overview of how our transformation board's moved on more recently. So we've now got the Health and Wellbeing Board at the top with an integrated commissioning executive. So that's our health and social care commissioners working together, with the Leeds Health and Social Care Transformation Portfolio Board, with a set of programmes that are being worked on in Leeds. So elective care, prevention, urgent care, admission discharge, goods and sports services, and growing up in Leeds, because it also is linked into our children's agenda. And as you can see down this side is a set of enabling groups, and the Leeds Informatics Board is on that page. So we're a key part of delivering the strategy and agenda across Leeds. So the governance is all joined together. So we moved on, and as we matured through that journey, and we then took what we got as a single blueprint on a page, and we looked at there are 3 tiers that we need to achieve. We refined that into, the first was the clinical integration, so that is that Leeds Care record. We then recognised that we needed clinical support tools to enable that information to be accessed and used. Moving through from that primary use of information into secondary use and business intelligence. And what we're using for that in Leeds is we have CareTrack as a system. We've pulled information from health and social care together, which is providing intelligence into that system. But the Leeds Care record is nothing to do with the secondary use. It's purely primary use portal of information that we pulled together. So what we recognised were the strategic requirements for transformational change had 6 key features, centering around the patients and individuals, with common data definitions, covering all types of care, relevant parts of the clinical record accessed by all those parties that are involved in care with the right role base, templates and expert systems supporting appropriate, consistent quality of care, and information collected and extracted to support holistic analysis and intelligence. So that's what we see as the 6 features of that informatics platform. We then moved on more recently, and we've put together what we see as a blueprint for where we need to be in the future for health and social care informatics. And we shared this. It links to our vision of a smart city and that wider technology piece across the city. We shared this with pioneers who also agreed with us that this does look like a model that is how we need to deliver the future. So I'll just very briefly touch on each of those areas. So the pink area is what we're terming citizen-driven health, which I'll come back to in the slot a little bit later on. But this is really about technology driving self-management, self-care. And if you remember the diagram at the beginning, that's the SAM with holding information and having technology that supports him in his daily life around social isolation and all those complex conditions, linking the professional with the person data. The orange in the middle there is our open data platform, and that is Leeds Data Mill, where we've pulled together data from the council, which is non-person specific. So it's all data sets we hold in the council, and other parties have put data in, and there's new intelligence being derived from that through hack days and pulling people together from the community to look at what new value we can derive from data. We've then got the Leeds Care record, which is the blue, so that's really the professional record, health record. Then we've got City Analytics platform, which is the university, and the data scientists and the research analysis that they're doing across the city. And then underneath that, we've got the 2 purple stripes there. We've got common end user computing platform. So what we recognise is for practitioners to work seamlessly, they need that infrastructure to enable them to operate. So one of the things we're looking at is how do we bring together a standard offer for Leeds, so that instead of people walking into a building, not being able to log on, not being able to work on Wi-Fi in certain buildings, not being able to work out in the community. So we're trying to get a coterminous infrastructure that supports that across the piece. And the other thing there is a public service network, PSN. As we know, local authorities operate on PSN. Nationally, the NHS work at the moment on N3, and we're looking at how those things are brought together as one of the projects within the Pioneer Informatics programme. And then that's completely circled by one information governance framework, because what we recognise is to enable that, the right information governance needs to be in place to protect information. I am talking very quickly, apologies. So taking our previous blueprint and laying that on there, that's where we're looking at for the future of delivery across health and social care. So what have those two blueprints enabled us to do? We've managed to establish a case for a citywide intelligence hub where we've brought together staff from health and social care to work on analytics together as a team that is now in place. It's helped us to get a case together to progress our citizen-driven health, which I'll come back to later. It's strengthened the city case for using PSN. We've recognised that this is much more than integration. This is really about how we actually operate together as a team. It's formed part of our Tech Fund 2 bid, which we've put there as open standards, open architecture, open source, and it's helped us to form our dialogue with other pioneer cities and to help us come and talk to you about it within and across the regions. And it's been the dialogue around our Better Care Fund. So, and we're at the minute exploring the end-to-end user compute opportunity. So how can we actually bring together the whole of our services, potentially in one new service offer? So we recommend the use of shared models, blueprints to form the basis of common language, common goals, engagement across sectors, development of business cases as a programme for delivery and a governance framework. So that's how we've used this. So moving on to what the questions that we're asking you to look at is, so in terms of governance, have you established the appropriate governance to support and enable the right conversations and decisions at the right time by the right people? And is your governance linked to the right governance framework, as in linked into the health and wellbeing agenda across the city or the area that you operate? And then secondly, we're asking you to look at, have you set out a clear blueprint vision? Has it been signed up to by all key stakeholders? And do you have a plan which sets out how you'll achieve that blueprint and vision?